What to do in front of someone having a heart attack or a STEMI. A quick reminder, ST segment elevation myocardial infarction or STEMI is a total blockage of a coronary artery which needs immediate coronary revascularization. The therapeutic approach of myocardial infarction begins with hospitalization in a specialized cardiac care unit. The patient should be placed in a semi-upright position to relieve pain, and subcutaneous morphine should be administered to decrease the intensity of the pain. If the patient is in a state of shock, intensive resuscitation approaches, including oxygen therapy, intubation, or mechanical ventilation, may be required. Giving inotropic substance like dopamine or adrenaline is a furthermore possibility in specific cases. When a patient is experiencing complications like cardiogenic shock or hemodynamic instability, the pharmacological treatment in acute phase consists of the systematic injection of aspirin as a loading dose of 215 mg through the vein, followed by a daily maintenance dose of 75 mg, which is taken orally. Aspirin is an antiplatelet medication that helps prevent the formation of blood clots, along with clopidogrel 300 to 600 mg loading dose, and then 75 mg daily. Clopidogrel is another antiplatelet medication that is commonly used alongside with aspirin in the treatment of STEMI. Low molecular white heparin should also be administered at a dose of 0.5 cc per 10 kg per 12 hours during the hospitalization of the patient. Afterward, urgent coronary reperfusion, which is the primary treatment approach to restore blood flow to the affected heart muscle and minimize damage, should be initiated as quickly as possible. Direct angioplasty with a stent placement is the preferred approach if a catheterization laboratory is accessible within 2 hours, if immediate angioplasty is not feasible within 2 hours, or if there are contradictions to angioplasty, intravenous thrombolysis may be considered. Although it is less common, thrombolysis should be performed within 12 hours of symptom onset or as long as the chest pain persists. Of course, contradictions of thrombolysis such as a history of stroke, underlying bleeding disorders, or other conditions should be respected. Within 24 hours of thrombolysis, a controlled coronary angiography must be done, followed by angioplasty of the blocked artery. Medication following discharge consists of lifelong beta blockers unless contradicted by decompensated heart failure or shock. Dual antiplatelet therapy with aspirin lifelong and clopidogrel should be continued for 1 year. Statins such as simvastatin are prescribed for managing dyslipidemia, alongside with angiotensin converting enzyme inhibitors or ACE inhibitors, which are recommended for controlling high blood pressure unless the patient presents with arterial hypertension. Additionally, a complete correction of cardiovascular risk factors means quitting smoking, eating a healthy diet, exercising regularly, etc. Hope this video was helpful to you, and if you have any questions, please leave them in the comment sections. Thank you so much for your support, and I'll see you in the next one.